Hey, Dave with Align Therapy here. I wanted to go over a recent research article that came out in November of 2022. It's from the Archives of Physiotherapy, and it talks specifically about bracing and scoliosis-specific exercise and the benefits of combining the two. I thought it was actually a really good research article, and it has a lot of cool points. So I'll try not to bore you too much with a lot of the details, but I think it's a good article. It's good support for conservatively treating scoliosis and spinal deformities, and so I wanted to share a couple of things about how bracing and scoliosis specific exercise can be used together. I think a lot of times it's thought of, okay, what do we treat scoliosis with? Oh, it's time to brace, but these can be done concurrently. These can be done at the same time. And so I wanted to talk about this article. So let's get into it a little bit. At first, it talks about their aim. So their aim was to investigate the effectiveness of a combined treatment with brace and PSSE for AIS. So AIS is Adolescent Idiopathic Scoliosis, and PSSE is Physiotherapeutic Scoliosis Specific Exercise. So Physiotherapeutic Scoliosis Specific Exercise is the umbrella that we use for the Schroth Method and the SEAS approach and a few other methods, but it's very specific that it's a specific school that is specific to scoliosis exercise. This isn't just core strengthening. This isn't just how they teach us in PT school to stretch the concavity and strengthen the convexity. These methods are much more in depth. One thing that was actually really cool with this was that they had 102 patients. They ended up having some that dropped out, so they had 95 patients for this statistical analysis, which, as far as Schroth Method and scoliosis specific exercise research articles, that's pretty high, and that's great. It provides a little more power to the study. So a couple of cool things in this article, and anyone that's really looking into the research behind scoliosis, this would actually be a great one to look at. It's open access. It's free to download the whole research article, and it actually goes through a lot in the introduction about scoliosis exercise and bracing and things like that. So it gives a good overview of that. But these patients received treatment that was Schroth Method based. So either with the BSPTS, the Barcelona Scoliosis Physical Therapy School, or a couple other techniques that they talked about specific to the Schroth Method. And so these were therapists that were trained in the Schroth Method, and that's what was being used. And then these patients were also braced with a Cheneau brace. And then they looked at classifying these patients on whether they were fully compliant, partially compliant, or non-compliant with bracing and with scoliosis specific exercise. So those three treatment groups, they call them group A, B, and C. So A is fully compliant, B is partially compliant, and C is non-compliant. And what they found, just if you look at the abstract and you look at the conclusion, they said a combination of bracing and PSSE can effectively treat adolescent idiopathic scoliosis according to SRS inclusion criteria, and 88.5% of patients avoid progression over 5 degrees, which is significant. I mean, that's what we're doing when we're treating scoliosis. We're trying to stop progression of the curve in these kids. So this is adolescent idiopathic scoliosis. So 88.5% avoid progression over 5 degrees. That's pretty awesome. And it means that what we're doing is effective. Only 6.4% surpassed 40 degrees in their curve. And so that's also significant, that we're not having many progress to surgical intervention. It's not a high percentage of scoliosis that gets to surgery anyway, but it's interesting that 6.4% got over 40 degrees, not even in surgical range, but at 40 degrees. Surgery is usually 45 to 50 degrees. So that's pretty cool. And then it mentions that in-brace correction and compliance are the most important prognostic factors for successful treatment. So what that means is when they're in the brace and they do an in-brace x-ray, if that in-brace x-ray is showing a better correction with the brace, then we have a better result conservatively. And compliance, if we have someone that's doing their exercises and is compliant, that also it yields better results. I mean, it doesn't make sense, it makes total sense to think that way, but it's interesting that it was very specific that those that were consistent in their exercises and wore their brace and had a good in-brace correction had a better result. So that the takeaway from that is, if you want a good result, be compliant. I mean, that goes without saying. In any type of physical therapy, that goes without saying. So a few things in this article that are interesting. I mean, the big takeaway is that it is effective. So when we talk about treating scoliosis, we're talking conservative treatment and we're talking non-surgical treatment. The Schroth Method, PSSE, Physiotherapeutic Scoliosis Specific Exercise, whichever method under that, should be incorporated into treating this. It's not something in my mind that should be an alternative treatment. This should be standard of care. The research that we're seeing, this isn't the first research article to say this. The research we're seeing is totally in support of this. And well, totally, maybe not 100%. There are some studies that show no difference, but the majority of studies are showing support for this, so it should be used. It drives me crazy when it's not being used. So the treatment protocol, I was talking about the Schroth Method, so that was with the BSPTS concept by Rigo, and the Schroth International Scoliosis Treatment, the ISST, and Schroth Best Practice, which is another way that Schroth is taught. So the results in this are specific to those who have been trained in scoliosis treatment. It goes through the results and curve progression and things like that, but one thing that I wanted to mention specifically is they mention that their combined non-operative treatment also improved aesthetics and quality of life aspects, which are described as primary patient-centered outcomes by the SRS and so forth. So the SRS is the Scoliosis Research Society, and the Cobb angle is only one piece of the puzzle with scoliosis treatment. We have aesthetics and how someone perceives themselves, how they perceive their body, and all those things. Those all have to be taken into account for quality of life. And we see that this treatment guideline, this treatment process improved the rotation, the angle of trunk rotation. We call it ATR in the spine, which reduces the look of scoliosis, which improves aesthetics, and people have a better body image of themselves, which improves quality of life. So that's pretty specific. But one thing that I think is not taken into account as much, a lot of these research articles, they look at, do these kids progress to needing surgery? In my opinion, yeah, I mean, we don't want them to get to surgery, but if they get to 39 degrees instead of 40 or 44 instead of 45, that's still progression. What I really want to see, and what I talk to my patients about, is have we done enough to reduce progression so that this doesn't influence things later in life? There's a lot of debate whether scoliosis can be, whether certain degrees create problems later in life. I've heard surgeons talk about, as long as you're not at 45, then you're good. I've heard them talk about scoliosis doesn't cause back pain later in life. I don't totally agree with that, because I see plenty of back pain with scoliosis adults. If we can keep the curve smaller, the possibility of that influencing their life later on goes down. And so I want to keep the curve as small as possible. So in this, it talks about The clinical relevance of our research was to maintain average Cobb angle post-treatment below 30 degrees, which seems to crucially decrease the risk of progression in adult life. So they probably have a little buffer in here, you know, at 30 degrees, if you're at 29, maybe you won't have progression as an adult. At 30 degrees, you might. You know, the research is still a little muddy as far as that goes. But if we keep someone's scoliosis curve below 30 degrees, the risk of progression later in life is significantly less. And I think we want to make sure we're not getting tunnel vision with how we treat scoliosis. That, oh, if we don't get to surgical range as an adolescent, then they're good and they go live their life. That there's an effect if they're at 40 degrees or 35 degrees. There's an effect later in life. So to preserve the results that we see in adolescence, we want to keep that scoliosis curve as small as possible. So I think that was a really good point. So I really like their conclusion. Their conclusion in this research article is non-operative treatment with brace and scoliosis specific exercises having adequate compliance and in-brace correction, so those two things, can significantly reduce the likelihood of progression and reaching surgical indication range. Our treatment protocol also, I think this is important, also improves aesthetics, trunk rotation, mental health, and function in adolescents with scoliosis. All of those things are very important. A lot of times we just look at whether they made it to surgery or not, but we want their mental health to be better, we want trunk rotation to be better, aesthetics, all those play into that, and their function as well. So I think that this research article is actually one of my favorites that has come out this year, because it really shows that we can make a difference. We can make a difference with conservative treatment with scoliosis. Even though a lot of times it's looked at as an alternative treatment, it's not brought up in consultations with surgeons and sometimes pediatricians because they don't know. And in this article, these were all the inclusion criteria were all patients who were braced, which means they were all above 25 degrees. So these are progressive curves, and this showed that we can have an effect on those curves and we can reduce progression. We can reduce surgery, we can improve aesthetics, we can improve the quality of life of patients with scoliosis. And the more we do that, the less impact that will have later in life. I see a lot of adult patients, and adult patients with scoliosis have I have a little bit of PTSD from when they were braced as a child, or when back when the Milwaukee brace was in and things like that. And I think we can do things so much better. We can improve the outcomes, we can improve the ability of these kids to reduce progression for the future. And I feel like studies like this really drive home the point that scoliosis specific exercise should be standard of care. It should be, especially when a kid is braced, they should be doing scoliosis specific exercise. There's enough research out there to support that. If we're not doing that, let's start doing that. If you're a provider watching this and you're wondering what to do with kids when they're braced and have scoliosis, this should be part of your referral pattern. This should be part of your plan of care. If you are a pediatrician and you're looking at the same type of patient, this should be part of our plan of care. And for those physical therapists out there, it's specific that it's a PSSE technique that we see results with. Previous research has shown that core strengthening and just general physical therapy doesn't affect the curve like we can affect the curve with a specific technique in treating scoliosis. So yeah, a great article. If you're looking for it, it's I'll put it in the description. Brace and Physiotherapeutic Scoliosis Specific Exercise for Adolescent Idiopathic Scoliosis Treatment, a prospective study following Scoliosis Research Society criteria. So if you're looking for it, there it is. It's a great support for what we do, and hopefully it helps answer some of those things on what we should do if we're braced. I hate to see it when kids are just braced. Then we're just relying on one method to treat that. Why not combine forces and get the best result possible? So thanks for watching. Sorry for my rambling. I kind of get a little passionate about this stuff. And don't forget to subscribe to our channel. I'll do other article reviews so that we can keep updated on those things. And hopefully this was helpful. And if you know of someone that could benefit from this information, share it with them, and I appreciate you watching. Thanks.